Welcome everyone to the State Technical Assistance webinar. Today we are very pleased to be offering our 9th webinar in this current year series. And we're focusing on workforce development and ways that you can increase the effectiveness of your work. And today is a reschedule of what we had intended to share in January. So we really appreciate you all joining us on a little bit of a different schedule than our normal state technical assistance schedule. Once again, we really want to thank the Health Resource Service Administration for their support and guidance in doing this work, and remind you that nothing today should be construed as the official position or policy of the United States government. Engagement is a really important part of our event today. And so if you would like closed captions, you can enable those yourself at the bottom of your screen. We will be looking to provide verbal descriptions and summaries of our slide content, as well as reading through the chat and making sure that we're identifying things in the chat. We encourage all of you to, while stay muted during the time that you're not the featured presenter, we do encourage you to unmute and engage in conversation, raise questions, etc. You may use the hand raise, you may throw something in the chat, or during the discussion, just unmute and join us in. We are recording today, and we will be sharing this recording and the slides on the CSN website under Resources Webinars following this event. Finally, we do encourage that as you're joining, that you take a moment and rename yourself to include your state abbreviation. It's really lovely as we try to create some more collaboration and cross-peer sharing, that we get a sense of where folks are from around the nation. Some of you may already know each other from joining in these events in the past, and some may not. So it's an opportunity to meet someone new. Finally, our community guidelines are that we are really looking at having everyone focus on intentional presence and bringing a curious stance in order to be partners in learning. Honor other people's perspectives, experiences, and learning styles, and be sure to take care of yourself as necessary. Before we go into our event, I would like to ask Catherine to share a quick poll. Again, we try to get a sense of who's joining us today. So if you'll just take a moment and let us know which work group you belong to. We would very much appreciate that. And if you don't see your work group agency listed here, please select other and then add that in the chat.
And in case people didn't notice, you can scroll down using the bar on the right if you want to see all the options.
Good call, Lauren.
Well, I was confused at first, and then I'm like, oh, so I thought other people might be too.
Okay, great. Thank you to all who participated. We appreciate that very much. We'll end that. All right, well, let's get going with our featured presentation today. So today's State Technical Assistance webinar is focused on data-driven storytelling in child safety. And we're really excited to bring this topic to all of you. Oftentimes, we find that, in trying to emphasize the importance of our work, it can get really tricky because you want to utilize data in order to be able to strengthen what you're talking about and give it credence. But you also want to make sure that you're able to make what you're talking about relevant and accessible to others. And so depending on the audience that you're working with, storytelling is a really useful mechanism in order for you to really be able to think about reconstructing your data that you have and the information that you're receiving from your data, the guidance, the insights, into something that can be more readily accessible as well as more impactful for different audiences. And that may be cultured in different ways. If you're reaching out to a funder, then you might be utilizing your storytelling and how you're presenting your data in one way. If you're reaching out to your target population, it might yet be a different way. And data-driven decision making is really critical in order to have effective means of achieving the reduction of injuries, hospitalization, and fatalities for children and adolescents and infants. So with that, I would like to introduce our two presenters today. We have Sarah Gabriela Hernandez from Education Development Center. And Sarah is an evaluator and researcher who specializes in community engaged and participatory approaches. She's collaborated with diverse organizations and community partners across Chicago in order to conduct mixed methods research, culturally responsive and developmental evaluations, program development and coordination, community health assessments and dissemination. And to learn more about Sarah, you can also read the rest of her bio on the CSN website. Then we will also be hearing from Lauren Gilman. And Lauren may be familiar to many of you. Lauren is one of the training and technical assistance specialists for the Children's Safety Network and is our content specialist for bullying prevention, leading the bullying prevention topic team in the Child Safety Learning Collaborative. And Lauren brings an integrated approach to advancing substance misuse prevention, social emotional learning, with an emphasis on interconnected risk and protective factors that fosters collaboration at the community level. And she'll be sharing a little bit more about some of the tools that we utilize in our Child Safety Learning Collaborative. And without further ado, I would like to hand this over to Sarah to get us started.
Thank you so much, Jenny. And thank you to the team. And thanks for everyone who's taken time out of the day to join us for the session today. As Jenny introduced me, my name's Sarah. Today I'm going to be talking through more so examples and case studies, if you will, of some of the work that I've been able to do as an evaluator, creating stories based on data. And so I've been doing evaluation projects for a while. And so a lot of my experience comes from the field of evaluation. I also do research. And so I think it's just important to add that to kind of frame where this is coming from. One piece as well, to kind of add on to like the positionality and like where these stories and examples that I'll be sharing are coming from. As Jenny mentioned, I do a lot of work in Chicago. It's where I live. And we've worked a lot with the Chicago Department of Public Health and agencies all across the city on a variety of different health areas. And so a lot of my examples will be coming from that place and that geography. So hopefully there'll be interesting examples that might influence the work that you all do and hopefully inspire some new creative ideas. And so before I hop into some of the examples, I think one of the things that's really important to ground this conversation is to start with a bit of kind of framing on not particularly what is data-driven storytelling, like not necessarily here's a definition, I'm going to present it to you all, have fun with that definition, but really more so I wanted to start with unpacking like what drives data-driven storytelling. So if you can go to the next slide. Again, from the perspective of an evaluator, ultimately for me, a lot of the work that I think about and a lot of the work that I engage in is around asking good questions, right? And I think data storytelling helps answer our questions, ultimately. We can think about data coming in a lot of different ways and influencing a lot of different aspects of our work. These kind of buckets of thinking about our audience, our programs or services, and our goals help us think a little bit about what is the story that we want to tell about the data that we have or want to have, right? And so I think starting from a place of asking good questions really, really helps to frame what is data-driven storytelling in terms of what can this look like for me in the work that I do. So when we think about the audience, right, what does my audience need in order to do X, Y, and Z, which can look different depending on where you are. Did we reach our intended audience? Did we address the needs of our audience? We can ask questions about programs or services, about implementation. So what's the story of the program? What's the story of the service that we did? What happened as a result? This is often the kind of question that we see answered through data-driven storytelling. What worked well? How can it be improved? And I think the column here that we see on the right-hand side of goals is like a really important part of data-driven storytelling that we can think about, which is, what does success look like? And did we achieve our goals and objectives? I think that first question, what does success look like? Again, as an evaluator, to me, I think that's one of the most important questions. So I think when I, was thinking about what to add for my portion of today's session, I wanted to start from a place of what's the question that we want to ask. And I feel like that helps make some decisions along the way in doing data-driven storytelling. So you can go to the next slide, Jenny. We're going to kind of dig in a little bit more into these questions, and then I'll share some examples. And so these are reflection questions. This doesn't come from like a toolkit, evidence-based resource, a thing, a PDF. This came from what do I think about on my projects and my teams? What are the questions that we ask each other when we think about data-driven storytelling? If we want to tell a story that helps us answer a question, what are the things that we think about prior? So ultimately, I think among the most important is, what's the message that you want to convey with the story? And so some of the questions is, what's the question we're trying to answer? What's the problem you're trying to solve? That's such an important question. Something I think is really important, because I'm a very action-oriented evaluator, is like, what's the so what, right? Like, we tell the story, and then what? What do you want people to do? What do you want people to learn, right? Thinking through these things with your team in advance of thinking before, like as you develop your story, as part of developing your story, is so critical. Who is your audience? This is such an important question, right? Because ultimately these other questions become so important, right? What's the best way for your audience to hear, read, see, or experience a story, right? And implicit in that, the story can be told and look many different ways, right? A story for community agencies is going to look very different than state partners, right? What considerations should be made for the audience to receive the message you intend to convey? It's a really good question to ask. You can go to the next slide, Jenny. The next piece is, what's the best mode to tell your story, or like medium you can think, right? I mentioned a couple of them. What consideration should be made about time, place, setting, people in groups, learning styles if you need. I think, having live translations, that's like the most clear-cut example of like the mode of telling a story. Is it verbal? Is it visual? Is it experiential, right? Like, you can get very creative with data-driven storytelling, right? But thinking through these questions in advance help you actually shape what the story is and what it should be. And ultimately, what's your objective? This kind of gets to the so what, which is, what do you want to happen after people receive your story? And also, what does your audience need in order to act? If that's part of your goal and what you want to do with the data that you have and the story that you tell. So like, for example, if you are trying to tell a story of grassroots community agencies who are working on services and programs, and that story is being told to state partners or philanthropic organizations or whoever the audience might be, and you want that audience to do something after telling the story, what do they need in order to act? That can also help you tell the story as well, in terms of what content you need in that story. And so these are just, I think, really helpful to kind of ground what data-driven storytelling can look like in a much more action-oriented way that gets us beyond just a definition, because what your story is going to be for your state, for your agencies, for your context is gonna look so different, right? I started this by saying I'm in Chicago and I work a lot with Chicago folks. Our stories are gonna be totally different than in other contexts. But I think it's so critically important. So you can go to the next slide, Jenny. These are just some examples that we thought would be helpful to include in terms of kind of like the mode or medium of what a story could look like that tells something about the data that you have. These are some things that you see pretty often in the space, which is a blog post, a web article, right? Very straightforward. Infographics that can be built on easy to use tools like Canva, for example, social media blast or social media toolkit to share stories. Data-driven storytelling can happen at community events. I've done a lot of that as well, and I'll share some examples of one of those. A podcast, a one-page brief, photography, right? So the actual, like what the actual story ends up in, right? The medium can look different depending on a lot of those questions that we just shared. But ultimately, regardless of what it actually looks like, sounds and feels and, you know, all of those things, right? How data-driven storytelling can really help support the work that you're doing is that it can really help with some of these things on the right-hand side, right? Depending on what your goals and objectives are for the work that you do. It can help support partnership building, it can help support policy development, sustaining programs and services, thinking through strategies, right? So as in the evaluation space, we're often talking about theories of change and strategies and how should we structure the work that we do so that we reach the goals that we have or the outcomes, right? And ultimately engagement with families and young people, right? Storytelling is so old as humans. And so it's a way to like really just connect, you know, with communities and families and children in ways that a research report might not reach them as well. So this is just a couple of examples to kind of share at kind of a high level. And if you could go to the next slide, I have 3 like deep dive examples that I wanted to share with you all based on projects that I've worked on in which we've done data-driven storytelling or have had elements of storytelling in the work that we do. So the first example that I have to share is an oral histories project. I thought, well, why not start with the most like one-to-one example of storytelling through oral histories, right? And so this work was part of a community health assessment project that we conducted in a community in the southwest side of Chicago, primarily Mexican immigrant community over like, oh my gosh, 10 years. And I think there were over 10 community partners. So this is very much more community-based work. It was a participatory research project. And our goal on the sort of academic university side of things, because this was a while ago at this point, was to identify community assets and engage residents in a community health assessment. Our partners had worked with us, our community partners, we all collaborated and they said, hey, you know, your surveys, your focus groups, your interviews, like they're great, but they're not cutting it. They're not telling the full and complete and complex story of community health in this community. So we need to do something else. And so we partnered with StoryCorps Chicago, which is, I guess, like local branch of StoryCorps Inc. At the time, to collect and record oral history stories. And these actually ended up being archived at the American Folklife Center and the Library of Congress. And they were on exhibition at the Chicago Cultural Center. So you can see this picture on the right-hand side was a little exhibition. All of those photos were taken. These were all part of our our community-based project in Little Village, but some of the stories that we collected in Little Village ended up as part of this. And they actually had a storytelling booth at the Chicago Cultural Center, which is a museum in downtown. So this was pretty amazing. And so if you could go to the next slide. One of the things that we did in order to tell our story and reach the audience that we wanted to reach is that we organized community events. We called them listening events for our oral histories. And so you can see this is like our flyer that we had back then, which is listening event stories from the Little Village community in Chicago. And so we wanted to disseminate our data, which was the oral histories themselves in this case, in a way that was meaningful for the community, interpersonal, interactive. And so what we did at this event is that we worked with StoryCorps to edit down clips of people's stories. We had 4 or 5. We had the whole room, the whole community folks in the space listen to these shortened, I want to say like 1 to 2 minute clips, listen, digest, have a moment of silence. And then we had discussions, and people from the community and the audience were invited to share what the story means for them, if it resonated with them, if they've had different experiences, if they wanted to expand on their own personal story. So it was a way not just to celebrate the community, which is what our partners had wanted us to do in the beginning, tell the story of community health in ways that really captured the complexity and the nuance from their perspective, but also to, you know, as researchers, like this was new data, right? We're able to collect more stories through sharing and engaging in this kind of cyclical way. So you can go to the next slide. The picture on the right-hand side was a picture from the event. It was at the Latino Cultural Center at our local university. And so it was a really beautiful space. We did 2 or 3 community events. And ultimately, in this particular case study example, thinking about data storytelling and using oral histories as the medium to do that, really highlighted this theme that stories had the power to convey complex issues and affirm the experiences of our community members. And so it was really a moment for us to be not just listening to our partners, but be responsive and tell their story in the way that they had more ownership of, and they were able to really communicate what they thought was important about community health in their community. So this was the first case example, which I think is probably, you know, again, the most like one-to-one. The next example, if you can go to the next slide, Jenny, was using photography to do data-driven storytelling. And so this is a project called Photo Voice. Some of you may or may not have heard this before. So Photo Voice uses photography to document experiences, perceptions, viewpoints, uplift voices of people that you work with. And so in this particular project, this was based in Chicago as well. And it was part of our work with the Chicago Department of Public Health. And we were working with 2 communities in 2 areas of the city that had been kind of like historically disinvested. And so there was a real focus on exploring community resilience in the face of trauma in these communities. That was kind of the kind of framing of this particular project. And we worked with young people in the community as our community ambassadors. And one of the things that we were really trying to understand was, how do we better understand community resilience from the perspective of young people who live in these communities, in Chicago's South and West Side communities? Because at least at this point in time in the city of Chicago, so much has been spent talking about trauma, right? And I'm sure you all are aware of trauma-informed approaches, right? And so this particular project was like, okay, let's focus on resilience. And what does that look like, right? So when we think about data-driven storytelling in this sense, what was the data? It was the young people that we were working with, their understandings and their perceptions about what does community resilience look like in my neighborhood, right? The way we communicated that, the way we told that story was through photography using Photo Voice. And again, like I mentioned, it's a community-based, it's a participatory research method. It helps us answer questions about community issues. And I think being on the other side of it, ultimately the really powerful part was it provided a platform for storytelling and creative expression for young people that typically isn't something that we tap into in the evaluation and research world. So you can go to the next slide. Oh, there we go. So part of our project and our work with our youth community ambassadors was before we even gave them cameras, which we gave them the little disposable cameras, before we even did that, the ambassadors thought, you know, it's really important for us to define what does community resilience mean for us in our neighborhoods? And they came up with these categories themselves. These are kind of the elements from their perspective of what makes resilience, what resilience looks like in their communities: peace and joy, improvement, safety, resources, connection. And so as part of this project, they participated in the Photo Voice curriculum that we developed, and we led them through. And the instruction was based on these kind of topic areas in resilience, if you will. Pick one. Take a photo in your community. What does safety look like in your community? What does community improvement look like? And how does that relate back to resilience? And so these are some of the photos that our community ambassadors did take on that project. And you could go to the next slide. And so at the end of our Photo Voice project, something that we did in terms, and this really gets to these questions of who's your audience and what do you want your audience to do? For this particular project, their audience was the community themselves. And so they felt it was really important to have an exhibition at the end of our project. And so what we did is we led all of our youth ambassadors to select a couple of photos that they wanted to present an exhibition. And we also engaged them in developing titles and captions for their photos. So they were the ones actually writing the story, right? And to us, in this sense, we considered both the photos, but ultimately the captions themselves and the themes that they were talking about. That was our data on our evaluation project as well. And so this is an example of one. You can read that. It's a long one, but I think the point here was that we led our youth ambassadors to determine their own titles. We encouraged them to write captions that demonstrate and tell the story of those categories of resilience. And so, like, why does this photo mean resilience to you in your neighborhood? And so the captions ranged quite a lot. We actually had a youth ambassador co-facilitate this part of our storytelling project. And she was encouraging the other youth ambassadors, like, listen to songs, read some poetry, like, use whatever you want to tell your story. And some of them were able to do that, which was pretty powerful. So we developed a Photo Voice exhibition. It was part of a restorative justice summit that happened in the community. So it was a very large community event. This was part of a community event where we invited folks to come in and learn more about the photography project that we engaged in. And so Photo Voice is a case example. Again, it is pretty like one-to-one with storytelling and data, but it offers, I think, what's unique about it. It offers an opportunity to think beyond, the story doesn't have to be written or heard. You can actually be seen and experienced. And so again, I think it's nice to, when we can, step out of the boundaries of, the PowerPoints and the reports. So you can go to the next slide. All right, so this last example, I'm thinking might resonate with some of you on the call. This is a project that was mostly in partnership with the Chicago Department of Public Health. We worked with their Office of Substance Use and Recovery Services for many, many years. And this particular example of data-driven storytelling was a particular way in which they used data visualizations to tell a story, to communicate kind of responsive and needed information when it came to substance use data trends, and more specifically related to opioid overdoses and reversals. And so part of this work, the context of this project, was that the Chicago Department of Public Health coordinates with various community social service agencies all across the city who do a very wide spectrum of prevention, response, intervention, treatment, recovery, harm reduction services, like the full 9 yards when it comes to substance use. And so they have a sort of like coordinated response network that they convene together on a monthly basis that works on opioid overdose response and recovery. they built this group to share monthly data trends. And with that, the goal of their data-driven storytelling and the objective in this sense was to facilitate coordinated resource response and sharing. And so I'll share what that looked like in the next slide, if you can go to that, Jenny. So I know there's a lot of text on the screen. You don't have to read it all. I'm going to talk through this. But what was so innovative about what CDPH did in these monthly coordinated meetings is they took their data, and this data is on emergency medical services opioid overdose responses. It's a mouthful, but EMS data for those of you in substance use who might be familiar. And we had an epidemiologist on staff at the health department that was like a pro in using GIS and mapping. And what they decided to do was create heat maps of particular neighborhoods in the city of Chicago that experienced the highest number of opioid overdoses. And so what the kind of tempo and the flow of this data-driven storytelling on a month-to-month basis was health department folks sharing out these maps with everyone in the coordination group on a monthly basis. So talk about like timely data, which is really important in the world of opioid overdose response. So they would share these heat maps that she was able to develop, and this is down to like the cross street level in the city, which is pretty incredible. And so you can see here in this heat map, we're looking at Humboldt Park, which is a community, and you could see like the hot spots in different parts of the city. And if you're in Chicago, you would be like, oh my gosh, that's at that cross street and that cross street, right? But what was really interesting on the left-hand side, you can see she pulled out data on in the red text of like how many overdoses in September of that year were in private residences, were in public locations, were in public transportation. This chart on the bottom, she also mapped it at time of day, which is pretty incredible. And so in this particular example, this is a really sure way of sharing very complex data to tell the story of like, here's what's happening in this particular community at this time at these locations, right? And the objective for this particular initiative was everyone on the call are the response agencies. So you would have, you know, a harm reduction agency, hey, we can send our outreach workers at this cross street at this time because we are seeing that overdoses are happening in the afternoons at this location. Can any other organization send out housing resources? Another person can chime in on the call and say, yes, we have a couple folks, we have these programs and services. So this was a really, really powerful and coordinated effort for city agencies to partner with service agencies across the city in a very coordinated way and very timely, right? And so they were able to essentially, they use this language, they were able to like flood these areas with resources and services to basically get people connected to care who were at risk of overdose. And so I thought this was another really good but very different way of thinking about data-driven storytelling. So you can go to the next slide, Jenny. One more quick piece that I wanted to give a shout out for this last case study example is the city sort of tracks the substance use data trends. One of the things that they developed, and again, this is a more conventional thing, right? Like a research report that tells the story of data. They developed an executive summary action report that summarized, here are the strategies that we are doing in the city of Chicago in partnership with all of our agencies to curb opioid overdoses and hopefully reduce the instances of overdose deaths, non-fatal overdoses, right? And so this was a really wonderful report that included various data visualizations, including some of those maps. But I thought this was a really wonderful report because it kind of went through, here's the strategy, here's the data, here's what we found. Here's the strategy that we did, here's what we found, while including some of these data visualizations. And this report, again, went out to city agency partners, as well as the, you know, all of the service agencies that were in that coordinated group. And it was a way to kind of show, here's the impact of what we're doing, right? This was to really show the impact and success. You can't really see it here on this particular slide. Let me see, I might do something, annotate here really quickly, but you can kind of see it on this visualization that I'm circling here, and I'll get rid of this in a second, Jenny. But this red bar shows 2024, and you could see here in the summer, these are opioid overdose related EMS responses, and you could see in 2024 this drastic drop between the previous 2 years in red, from blue to red. So this was a really, really powerful way to communicate about here's what we found and this is the success of our work. And so I thought this was a great example too to kind of pair with the other two more creative storytelling methods. But ultimately, I would share, you know, it all data-driven storytelling is all grounded by those critical questions that we start out with at the very beginning. So I think that those are wonderful resources. And looking forward to questions and conversation later on. That's it for me. I'll pass it back to you, Jenny.
Excellent. Thank you so much, Sarah. And I'm actually going to stop the share for a moment because we've had a couple of comments in the chat. I thought it would be worthy of actually pausing here to talk a little bit about what you presented before we move on to the next part. So as you scroll back, you might see that we've had a couple of examples of ways that folks on the call have shared their stories, and they've included infographics. Sounds like Jeannie Beats in Nebraska is also doing a teen driver map, which I think is a heat map. Jeannie, is that correct? Is that what you meant by a teen driver map, or did you mean something else?
No, it's to display the data for each county and let them know what's going on in regards to teen driver safety, from their seatbelt use to driver's education uptake, their crash rates, and then what projects, what are they doing to address those? So peer-to-peer education, are they doing a parent outreach, those kinds of things, to kind of get people to take action of sometimes you don't know what you don't know.
I love that, both in terms of it, you know, as Sarah's described, you know, the ability to be able to kind of give a broad scope representation, but also that then not only do you not know what you don't know in maybe your own community, but now you can also see yourself to contrast and compare to neighboring communities to maybe then identify where there are resources that you might want to get into, or you know, other types of follow-up. So it's a great way to stimulate potential action, as you said, Jeannie. And then, you know, Sarah, you shared some of these other traditional things. Heat maps is a very common way, I think, of having visualization of data. Internally, the idea of sharing it out, I don't think happens quite as often, but it's another great way to kind of do the same thing there. And I love this pairing that you just did, where, you know, we, again, traditionally use charts and graphs and so forth, but to really pair it with the idea of a story instead of, you know, just a straight up data description is so powerful. And then I wanted to note that there's also a comment from Dana in Kansas about a brand new approach. And so Dana, I know you don't know much about it, but I'd love to hear a little bit about the concept of your data walk.
Well, we actually had considered a data walk for a pre-conference institute of the Governor's Conference for the Prevention of Child Abuse and Neglect last year. And we ended up going in a different direction because we just really didn't know enough, and we're still learning. But my understanding of a data walk, and we have partners who have successfully done it, is, you know, instead of having a formal presentation where people are listening to someone, an expert perhaps, talk, they have the opportunity to go around the room and view different posters and have conversation about what they're seeing in the data that's presented on those posters. That's about all I know.
That's a great example of blending this piece of like, we're sharing the story, but we're still making the story, right? Like the story's not ended yet in terms of continuing to add to that story and data that you're collecting. That's awesome.
Yeah, I did have two questions that I posted in the chat also. May I ask them now? Okay. The first one was, as you were discussing storytelling, I wondered how you, what mechanism or how you obtained consent for use of personal stories, and if you have any guidance when, you know, our goal would be often to collect personal stories from youth or minors. And there are, my experience has indicated that there are issues with getting that parental consent at times.
Yeah, yeah. There's definitely a very well, I guess it depends on your institutional review board if you're working with research or evaluation partners. But I, you know, like coming from the research space and the evaluation space, like typically there are processes and procedures and like templates in place to acquire consent. For children and for vulnerable populations, there's usually a parental assent process that includes both working with parents and guardians to also achieve consent. Yeah, and sometimes it is challenging, right? But there are templates and resources that are available. Are you working with research partners in this work? Or are you research partner?
No, I'm at the Department of Health and Environment, but we do have an IRB, so familiar with that. And you know, just thinking that sometimes our partners who don't have an IRB don't have this guidance, and what might be best to share with them as they're collecting stories outside of what maybe we would do, and what the best form. Is it a signed paper form? Is it an online opportunity to complete a survey where you're then entering information? You know, what are some examples of consent that you've used?
I think, again, it goes back to those original questions of who's your audience and what's the best way for them to like receive the thing. So it depends on the community. In my experience, and I would invite others on our team, like, I don't know, Alyssa, if you've done this kind of work before too, you can share examples and chime in. We've done paper cards, like for Photo Voice, that's what we did. We just did like paper cards. We had them sign it because we were doing sessions in person. And also a lot of the ambassadors on that project were not really on their phones, surprisingly. They were just like not into the phone stuff. So they were like print outs. They wanted everything printed out. They wanted everything written down. And so that's how we did it. We also built in a session in our Photo Voice curriculum all about the ethical side of data. Because this is their first time really engaging with asking evaluation questions, asking research questions. And so we, prior to doing consent as part of our Photo Voice, you know, project and procedures, we had a session around like, this is why this is important. You know, we want to protect people's data, and especially if they're coming from vulnerable communities, especially if they're young people. And in our project, because it was photography, we were able to use examples of like, like when you take pictures, you need to ask for consent and assent of everyone in the picture, because what if there's a person in the community who's in your picture and they don't want to be in your picture and you're putting them on exhibition? What's going to happen then? So like it led to a lot of really good conversations, which again, for that audience, they like printouts and they liked conversation. And so that's the way that we went with. But I think you can, you know, depending on who you're working with, there's probably definitely ways to do it in terms, you know, you consider like QR code, you know, QR code on the phone, sign the form. But I think the important piece too is for community partners who have not engaged or aren't familiar with IRB procedures, just having a couple of those talking points in your back pocket of like, you know, we know this is dry, we know this is procedural, we know it might be coming from a certain place where you're like, this is hard, but it's really important because we want to protect people's data. And it's really important to maintain that for folks, especially if they're children or vulnerable populations. I don't know, others. Alyssa, did you have anything that you wanted to chime in? No? Okay.
Thanks, Sarah. No, I'll give a 5-second to build off of kind of what you said. My experience has not been with the very littles. It has been with doing like workforce programs with teens, really on like the west side of Chicago. And we did very similar to what Sarah described. But one of the things, we did two things, which I'll add. We had our teen groups, we had kind of two leaders, and the leaders made like fold out pamphlets. And the fold out pamphlets were kind of like, these are the things that we think are really important of like why this could help our community. And these are the questions that we had. And so they made this fold out. And then we invited the parents and community members to come and to listen and to ask questions. And we also had, it was a very large newcomer population as and Spanish speaking communities. And so we had folks that were there that were that could translate and could and so and we had a little food, right? Where they could say, hey, what are they going to be doing over here? So that it wasn't to kind of move away from some of the fear. And then we talked about, hey, when this does get shared out, if it's okay to be shared out, we're not going to be the sole holders of this. And so we partnered with an organization called Crossroads, which is in Chicago, and we made sure that the communities knew that even though we were gathering this information, we were trying to, and it was a program to increase mental health professionals, and to have kiddos who are in high school to think about being mental health professionals. And so anyway, but yes, to your point, we had a lot of physical copies, and we just wanted to make sure folks knew this was our process. This is where it was going to go. Is that helpful for you?
But thank you for that information very much. Do I still have time for my other question?
Dana, I think we're going to actually go to the second part,
Okay. Sure.
save your question. I've pointed
Yeah.
it out to Sarah, and she's thinking about it so that we can address it. It's a very good question.
Thank you.
You bet. So Lauren, I'm going to hand this over to you for a little bit further.
Okay, great. Thank you. And thanks so much. And thank you, Sarah, for all of those great, amazing examples. I was especially interested in the one on photo voice. I actually worked on a project a few years ago around problem gambling prevention. And that was one of the strategies used with youth, where it was it was adapted to be a way for young people to take pictures of examples of gambling in their community and then share that with adults. So it was actually a really interesting way of using that as a storytelling mode to move this project forward and to kind of raise awareness of the kind of the gambling's really everywhere. So I could see it being used for a lot of the different kinds of prevention topics that we have through the CSLC. But what we're going to do now is move on towards storyboards. And I wanted to see if, for people who are there, if you could raise your hand if you created a storyboard. You can do it by, yep, I see some hands up, or you could also use your hand raise function if you'd like. As most of you know, this is something that we ask the CSLC participants to do towards the end of each cohort. And it gives people who are doing this work a chance to do a few things, a chance to reflect on what they're doing, first of all, then a chance to share what they're doing with peers across the country, because we have conversations about it across the different groups, state groups, and then also have a product that's ready, that can be adapted for key audiences in their own states. Actually, why don't you go back one, Jenny? So what we're going to talk about now is, first of all, what is a storyboard? So storyboards are one more example of how you can present information or messages in a way that's visually engaging and that's useful for many different audiences. It could be used for young people, for community members, for family, all the way up to funders and big high-level decision makers. The content may have to be adapted for different audiences, because I just wanted to quickly kind of reiterate what Sarah said earlier, which is that anything that you're doing, from a storyboard to any sort of project where you're doing storytelling to share data, the thing to start with is the so what, is what's your message? Why are you doing this? What are you trying to convey? What are you trying to accomplish? Instead of starting, I used to work in substance use prevention, where people would jump to, well, we need a Facebook thing, or we need a billboard. But well, take a step back. What do you want to accomplish first? First comes the message, and then comes the audience, right? If you're, and then after that, you're thinking about the mode to tell the story. And a storyboard can be a mode of communication for lots of different audiences, but it won't look exactly the same for each one because you're trying to really capture their attention and make it engaging. So why don't we go to the next slide now? So why create a storyboard? Well, I kind of like how this slide frames it because it frames it first as an activity that's helpful to the team that's making the storyboard, right? If you're leading or implementing a public health project of any sort, any kind of prevention project, this is a way to think through and focus on like a sequential visual representation of what you're doing. So you really have to think through like what you've done step by step and how it's having an impact. So this can serve as a roadmap for the work that you're doing. It can also help to identify gaps because as you're mapping out your work, you might realize, oh, wait, there might be one group in the community that doesn't really understand what we're doing or why or what we're trying to accomplish. So then you might take a step back to do some more careful planning. It's also a really great way to highlight your accomplishments, to celebrate. I think often we focus on what are the challenges and what are the things that aren't working, but it's a way to take a step back and say, hey, this is what we plan to accomplish. This is what we've done. And this is how it's worked. And then think about how these accomplishments can be shared and with who you want to share them with. So again, it could be program recipients. It could be the people who are, getting the messages or receiving the child passenger seats for their cars. It could be the people who are getting the materials and information about safe sleep, or it could be the people who need to hear what you've accomplished so that they can keep funding you. It could be funders or potential funders. It could be decision makers at the state level. And, like I said, you'll need to make adjustments for each audience, but if you create a storyboard, you'll have something ready to go as a starting point that can then kind of be adjusted for different audiences. So why don't we go to the next slide? And so for CSLC participants, we provided some guidance and we also provided an optional template for creating storyboards. And that, like the purple box up there on the screen, is like a ready-made outline. So if you fill in the information for each bullet point, there's your storyboard. For each item, you can embellish a little, you can go deeper. It's important to add data, but the idea is to keep it straightforward and clear, not too long. So your project rationale is your goals, right? It can be stated quantitatively, like a percentage change or improvement, or it can be broader, like we want to improve school climate to reduce the prevalence of bullying, or educate new parents on the risks of co-sleeping. Like, what is your rationale for what you're doing? And then under the approach, you might have a theory of change. You might include some details about how you're going to collect data or measure your progress. And it might be like an explanation of like who's doing the work, who are the partners you're working with, what are people's roles. And then the impact story is the progress you've made. So what is the data saying? And it's really important, as Sarah was just describing, to balance out and use both quantitative and qualitative data, like to really illustrate in a visual way the impact of your work. And are there any lessons learned? And then the next steps is like how you're going to spread this, how you're going to scale it up. And the storyboard is also, as the blue rectangle illustrates, it's a great way to illustrate a plan, do, study, act cycle. And you could do that with just one or maybe two slides for each stage to map out what you've done, map out what you've learned, and map out what your next steps are. So I just wanted to go on, if you can go on to the next slide, we were going to just show really quickly a couple of great examples from people from states who happen to be on the call today. We have one from Kansas, from Texas, and from Nebraska, and we're just going to talk through them real quickly. But if at the end, if anyone has a question for any of these folks, they might be available to answer them. But they've given permission for us to share these slides with all of you today, so thank you. The first one we have is this one from Kansas, and the topic for this was suicide self-harm prevention. And I like this because it has a really clear aim statement. It has a quantitative goal, and it's about increasing access to self-harm and suicide prevention, education, and resources. So they gave their aim, and then they provide an illustration of some of the resources they've developed for different audiences. And we don't have too much time now, but if anybody can just kind of put in the chat quickly, what audiences are being targeted by these? What are some of the audiences that this team was trying to reach through this work? It kind of looks like there's a lot of different kinds of posters or kinds of flyers here. Yeah, so yeah, it looks like young children, it looks like teens, It looks like some of them might be more adults. There's one about keeping them safe, right? So that one might be something for like parents or adults who are working with young people. So there's a whole bunch of different flyers or different visuals that go with different populations. So that's a good illustration of what we've been talking about. So thanks for Kansas for sharing this one. Let's go on to the next one. This map slide is a great illustration of like the reach and scope of this Texas Child Passenger Safety Program. It's about safe riders distribution partner sites. And I love the colors here. It's a way that you can map out where these programs are, but also map out how far people in different locations in different counties around the state are from one of these locations. So when I looked at that, my first question was who's the audience for this kind of an illustration or a map? I don't know if anybody has any thoughts about that. But who's the audience, and then what questions you might have when you see this, because you might want to know, like, oh, there's big gaps in the state. Why is that? What are we going to do to fill them? And it looks like, maybe perhaps they're concentrated in areas with more population. Maybe this is great information for parents. Yeah, someone who's looking for a distribution site or determining where to target a new one. Perfect. Parents, local programs. We're running out of time. Why don't we do the last example here? This was from Nebraska. So thank you, Nebraska, for providing this one. And this is another great example of a storyboard. It would be, since it's progress to date, it would be one of the later ones. Like they already talked about their aim, they talked about what they did. And now here are some examples of some of the billboards and posters that they've come up with. And I thought these were great examples. And I was going to ask what stands out. But I think we're actually pretty short on time. So I would love to hear any reactions to any of these slides. Or any other questions remaining, either about storyboards, about anything that Sarah talked about, or anything else. So feel free to speak up, unmute yourself and ask a question.
I think storyboards are a great way to show your progress. And it makes you sit down and really look back at what you've accomplished, because you don't always really see it until you see it. So if anybody has not ever done a storyboard, it's really a good process to go. And then now you have a historical, documentation of what you've done throughout the years to track back and look what else needs to be accomplished in the future.
Right. It's like a snapshot, right? You have that snapshot and then you're able to use it moving forward. And Jenny, I wanted to make sure that we have time before we finish here to just talk about applying for cohort 2. I think all of you or most of you are in cohort 1 now. So here's just some information about it. Jenny, I don't know if you want to say anything more quickly before we run out of time about this.
Yeah, as we are down to the end of the time, I'm going to just say that we do have cohort 2 of the Child Learning Safety Collaborative, and you can find out more information on our website. We will send out information as a follow-up to everybody as well.
So thank you, everyone. Sorry we're so rushed at the end here. Huge thanks to Sarah for your amazing examples and of the work you've been doing. I love the illustration of all of that. Thank you to all of you who participated, who came here, who shared with us today. If you have questions that didn't get answered, email us and we'll get back to you. We'll try to get back to you with the answers to some of your questions. And here is the link to our quick evaluation. If you have a moment, you can either actually, there's a QR code on the next slide. You can either use that or you can just go to the link that's in the chat and quickly answer. Jenny, maybe go to the last slide just in case anyone wants to use the QR.
I'm not sharing anymore.
Oh, you're not. You're right.
No.
You're not. I'm looking at it, so never mind.
That's
okay. Well, then
that's why I didn't have anything
I'm
to
like
share.
looking
And
at it on my
Dana,
screen, like, why isn't she moving it? Because it's not up
that's okay.
there. So anyway,
Dana,
yeah.
I just wanted to point out, Dana, that there was an answer that Sarah put to your other question in the chat, and so I hope you had seen that.
Oh.
So I just wanted to catch that before we
Thank you. I didn't see that, but thank you for that, Sarah.
You're welcome. And we're going to stop the recording here, but I am welcome to leave the room open if you do have any other last minute questions. This was so wonderful and engaging. I just want to make sure that we open up the time for that.